Good morning, everybody. I am Sharice Magoon with UT Health School of Nursing. You were signed in to hear Ms. Christina Allen and Ms. Edith King presenting Women and Substance Use, Understanding Stigma, and Navigating the Continuum of Care. We are so happy that you have joined us for Texas NAS Awareness Month. These free CE presentations are sponsored by Texas Health and Human Services. We will go ahead and take questions via the chat at the end, so please hold your questions. I would like to introduce Christina Allen. She is a licensed chemical dependency counselor. Currently, she is the program specialist overseeing treatment services for pregnant women and women with children for the substance use programs, planning and policy unit of Health and Human Services. She graduated from Texas State University with a Bachelor of Science in Psychology in 2012 and with a master's in community counseling from the University of Texas at San Antonio in 2014. Christina has experience working in mental health crisis, substance use, and medication-assisted treatment settings. Our other presenter is Edith King, MA, LPC. She is a licensed professional counselor and the Outreach Screening Assessment Referral, OZAR Waitlist, and Capacity Coordinator for the Substance Use Programs, Planning, and Policy Unit of Health and Human Services. She graduated from the University of North Texas with a Bachelor of Arts in Psychology in 2010 and her Master of Arts in Professional Counseling from Texas State University in 2013. As the OZAR Waitlist and Capacity Coordinator, Edith works with OZAR programs across the state and manages waitlist and capacity protocols for state-funded substance use treatment providers. Without further ado, I'll hand it over to you, Christina.
Thank you, Sharice. That's all the kind words. It's appreciated. As she stated, this presentation is about women and substance use, understanding the stigma, as well as navigating the continuum of care. My name is Christina, and I will be starting off our presentation today. Next slide, please. The objectives of this presentation are to understand, as we stated, the stigma around parental substance use, navigating the continuum of care, as well as substance use resources. With that being said, we recognize there are people who have registered for these events that are out of state. So we are going to be discussing some resources and materials that are specific to Texas residents, but we will do our best to be mindful throughout the presentation to specify which items are Texas versus which items are nationwide. Additionally, when we're discussing certain programs and service types, some of these might be specific to Texas. So just be mindful if you are from out of state that these might go under a different name or these services might not be available in your state if you're outside of Texas. Next slide. So this first section about stigma surrounding parental substance use, we're going to be discussing substance use among women, prescription painkiller overdose deaths, Texas maternal mortality, mothers in treatment, as well as treatment barriers for women. Next slide. So now, before we truly dive into this, I like to start off with an example that one of my mentors used to give in her presentations. And I really enjoy this example because I feel like so many people, not only myself, but many people can relate to it. And it's a little bit more difficult to judge because I'm not in a room with the people watching this. But typically, I'd like to ask, how many people, show of hands, drink coffee every day? And the reason I bring that up is I'll share my own personal experiences. When I first started drinking coffee, it was in high school. I would drink coffee. It would be really, really sweet, lots of cream, sugar, lots of whipped cream, caramel sauce. And it was something that I would basically treat myself to once a month, once every couple of months. And that was my beginning experiences with my love and caffeine enjoyments. So as time progressed though, Then I started using coffee every day. First thing when I woke up, I'd have my coffee, pour in some cream, pour in some sugar. Um, Not whipped cream anymore, no more caramel sauce, so it was a little bit stronger now. And now I've increased my use to daily. So now we flash forward, here we are today, right? I drink 2 cups a day, sometimes 3 if I'm having a rough day. No sugar at all, very little cream, very bitter coffee. That's how I enjoy it today. And I like to bring up this example just to kind of show that when we think of substance use, it's not something that happens overnight. It's not something that someone wakes up one day and goes, ooh, I think I want to go down this path of being dependent on substances. It's something that, due to various risk factors and protective barriers, that influences what the outcomes are. And so I like to always bring up the coffee example, because how many people can relate to that when you look around almost every corner in a major city and see a coffee shop on the corner. So I like to start with that example just because it's something so many people can relate to. So with that, we'll dive back into the slides. Substance use among women. We know they tend to be more complex and highly correlated with comorbid conditions, such as depression and anxiety. Low socioeconomic status, as well as domestic violence or intimate partner violence, and trauma are common in women with substance use disorders. More specifically, having experienced personal violence and trauma is reported by 50 to 90% of people with a substance use disorder. Individuals may attempt to relieve stress related to past traumatic events through the use of substances, or they may be more at risk for experiencing traumatic events as a result of their substance use. A good example of that might be someone who tends to use with a friend, family member, partner, and they might witness their partner overdosing next to them. So that would be additional trauma that they've endured, and now that might continue the cycle of that repeated trauma and use. So the next piece says traumatic events occurring during childhood are strongly correlated with substance use disorders, and the severity of the childhood trauma is a significant predictor of substance use disorder relapse in women attempting to recover. Further, women may be reluctant to seek help with a substance use disorder due to the social stigma and the fear of losing custody of their children to Child Protective Services. This last point in particular is something I really like to highlight as a very real fear for women who are experiencing a substance use disorder. They realize they need help, they want help, but they have a lot of fear about, by asking for help, they jeopardize losing their children. So I also like to give an example of that from when I previously worked in a medication assisted treatment clinic, or MAP. One day there was a woman in our lobby who was crying and scared, and she was pregnant. She came to our clinic because she wanted help. She wanted to stop using, but she knew that by stopping her use of opioids, she jeopardized not only her health, but the health of her unborn child. And so she was caught in the middle, because she was also afraid that by coming to our clinic, she was terrified that we were going to automatically call CPS and her child be removed once she gave birth. So this is a very real fear for a lot of moms in asking for help, and offering her reassurance, offering her, not shaming her by asking for help. We were able to get her connected to services. And I'm happy to report, we did admit her, and she went on to give birth to a beautiful little baby. So, and was very successful in the program. So I just, again, like to highlight this story, because if this is a very real fear for these women when experiencing a substance use disorder. Next slide. So this next slide shows prescription painkiller overdose deaths. And this one in particular, this study was done back in 1999 to 2010, but we recognize that the use of opioids in deaths has just continued to rise over the recent years. Gender-specific studies focused on illicit substance use shows that there are distinct differences between men and women with a substance use disorder. For example, when compared to men, women are more likely to have chronic pain and be prescribed prescription painkillers at a higher dose and for longer periods of time. Women are also more likely to engage in doctor shopping and more rapidly become dependent on painkillers. And as you can clearly see, opioids is a significantly higher rate of increase compared to the other substances. Next slide. This is another set of data that's really important to pay attention to. All cases of maternal death in Texas must be reviewed by the Texas Maternal Mortality and Morbidity Review Committee out of the Department of State Health Services, with the exception of motor vehicle accidents and non-pregnancy related cancers. So with this data, what they review is, this is data from the Centers for Disease Control, and their definition of pregnancy-related death, which is defined as the death of a woman while pregnant within 1 year of termination of pregnancy, irrespective of the duration and site of pregnancy, that any cause or aggravated to her pregnancy. So the things they look for are pregnancy complications, chain of events initiated by pregnancy, or the aggravation of an unrelated condition by the physiologic effects of pregnancy. So based on the data from that they've looked at from 2011 to 2012, they found that Black women bear the greatest risk of maternal death. Cardiac events, overdose by illicit or illicit prescription drugs, and hypertensive disorders are the leading causes of maternal death. And again, as you can clearly see, those are the top 3 in this chart. A majority of maternal deaths occur more than 42 days after delivery, and a majority of maternal, and the data quality issues related to the death certificate make it difficult to identify a maternal or obstetric death. So this, again, after reviewing all the data, they find that maternal death observed and the reviewed cases of maternal death and observed that mental and substance use disorders play a significant role in maternal death, and also found that repeated missed opportunities to screen for and refer women to treatment for mental health and substance use disorders is regularly occurring. I can speak to on national calls, this tends to be a recurring theme that women with a substance use disorder are missed in a screening, or if they are screened appropriately and it is diagnosed, they are diagnosed to have a substance use disorder, that people aren't sure where to send them. And so that's why, and it's part of this presentation, you will be learning about different referrals and resources available. So that way, if you find yourself with a woman who has a substance use disorder, you know where to send her and refer her to. Next slide. So mothers in treatment. So most mothers who are in substance use treatment feel a strong connection with their children and want to be good mothers. I think that's what all mothers feel, right? Not just women with substance use, but all mothers feel that. They want to be a good mom to their children. Most women who maintain or regain custody of their children, and most women want to regain custody and become competent parents. Women who believe they have not cared for their children adequately, or who believe they are perceived as having neglected their children, carry enormous guilt. This is absolutely something we see in substance use treatment that also contributes to return to use. The woman experiences large amounts of guilt regarding her use and the care of her children. Unfortunately, if the women receive inadequate role models in their own lives or lack of information, skills, or economic resources, this could result in make motherhood more difficult for them if they don't have proper resources. So they also have the challenge of facing the work necessary for recovery for the tasks of being mothers. So in addition to doing all the things you need to do to be a mom, you also need to work on your recovery, which can prove to be challenging for them. Ensuring safety of their children while respecting the mother's choice to care for them requires careful case management and provide support for the mother. And this is a SAMHSA tip as well, as far as the best support. Women tend to develop their sense of self through relationships. A woman's identity is also deepened when she becomes a mother. Society places a high value on a woman's ability to mother, and her own perceived success or failure in this endeavor forms an important aspect of her self-concept. I think, again, we can all agree this is something all women experience who are mothers. They face this as part of their self-identity. Next slide. Treatment barriers for women. So this is something we hear a lot. The woman is identified as having a substance use disorder, or someone says she needs help, and they say, well, why don't you just go? It's just go to treatment, go get help. Or why can't you just stop? This section is about stigma. I've heard people say before, well, you chose drugs over your children. It's not so simple. There are barriers to getting treatment for what the mother needs. There are some of the many reasons that are a barrier is, number one is children are in the home. As we just discussed, she's caring for her children. Who's going to care for those children if she goes to treatment? So many of these women also have a lower income or may have non-reportable income, such as doing childcare or odd jobs. Additionally, they might be unemployed, so they don't have insurance. So if they go to treatment, who's going to pay for that treatment? And as we all know, treatment is not cheap. So they're also impacted by, again, social stigma, as we've already been discussing. She might be pregnant, so she shouldn't be using drugs. And of course, as we said, lack of childcare. If she wants to attend outpatient, maybe she doesn't need residential services, but she's interested in outpatient services. Well, while she's attending those groups or classes, who's going to care for her children while she's at the treatment facility? So, and again, I can speak to this in Texas, the treatment providers I work with, the top two barriers for their women engaging in services is lack of childcare and lack of transportation to the facility while the woman's receiving treatment. So women often have a different pathway to using. They were using in the context of relationships again. So they might suffer different consequences when they're using. Again, as we previously stated, child endangerment, so CPS might get involved. So there are also differences in which drugs women choose to use. And the relapse triggers and frequency and why they use. So some reasons why women might use or relapse might be to lose weight. It might be to relieve stress or because of boredom. They might use to improve their mood, or maybe it helps to provide them energy to get their tasks done, right? Like think of all the things you've seen your mom, or if you're a mom, all the things that need to get done in a day. So she might use something that helps her have the energy to get those tasks done. So she might also use to increase her sexual drive, as well as she might use for self-medication. So as we previously stated, a lot of people who enter treatment have trauma or experience trauma. So if it's never been treated or managed in a healthy way, she might be using to self-medicate that, as well as unmanaged mental health in addition to that. So women will accelerate to injecting substances faster and tend to have earlier patterns of dependence. It is incredibly important if a woman is using opioids to not tell her to stop using if she's pregnant. This jeopardizes not only the health of the woman, but also the unborn fetus. This is something she should be addressing with her healthcare provider in order for them to come up with a safe plan to keep both her and the baby healthy and safe. Next slide.
Hi, everybody. I'm Edith King, and I'm going to go ahead and start talking to y'all about the service continuum of care that we have here in Texas. As you can see, we have about 4 different services that are available, and I'm going to speak to you guys a little bit about them. We have the substance use and misuse prevention. We have substance use intervention, substance use treatment, and recovery support services. Christina and myself are, we work mainly with the intervention and the treatment services. However, we felt that it was important that we include all of these services in the continuum to make sure that you're aware of, all that our state has to offer. Okay, so the first service is substance use and misuse prevention programs. And those programs use evidence-based curricula to provide primary prevention and behavioral health-related information and data. They also engage and mobilize various sectors of the community to implement evidence-based environmental strategies to change policies and influence social norms related to substance use and misuse. One of the neat things about these programs is they really work to increase protective factors in an individual's life. So protective factors would be things like positive peer and family supports and healthy coping skills. And by increasing those positive protective factors, or just increasing the protective factors, you'll decrease the chance of substance misuse. And then, the programs also work to decrease risk factors, and those can be things like family or parental substance use, lack of positive peer support, maybe maladaptive coping skills. And by decreasing these risk factors, the likelihood of substance misuse will also decrease, because the more risk factors someone has, the higher the likelihood of substance misuse increases. And so you can just kind of see on the slide that they also have benefits including positive, healthy, drug-free life, family bonding, and positive behavior in a school setting. All right. Substance use intervention programs, we kind of have a myriad of them here in Texas. The first two are the HIV outreach program and the HIV early intervention program. The HIV outreach intervention provides harm reduction, community-based services to address and reduce HIV transmission with populations who use substances. Then the HIV early intervention services provide case management through referrals for medical, mental health, substance use treatment, and education and overdose prevention training for individuals with HIV and who have HIV and are also engaging in substance use. And as you can see on the screen, it does say that these programs are being phased out, which they are. And that is because we are going to reformat the programs to meet a wider population. So they're going to be ending as of this fiscal year and then reformat it. The next program is OSAR, Outreach Screening, Assessment, and Referral. And this program works to connect individuals who are seeking substance use services, connect them with those services in their area, whether it's treatment, an intervention program, recovery program. OSAR really works with those people and those individuals to find the services that they need. The next one is Pregnant and Postpartum Intervention. This program works with women to address substance use impacts on the family through case management, home visits, and education. Then there's the Padre program, which is a community-based intervention program for fathers and soon-to-be fathers who have DFPS involvement. This program provides case management based on individual needs, as well as connection to community services and education. The last program is the Rural Border Intervention Program, also known as RBI. This intervention program serves individuals in remote border areas. And so these individuals, in order to qualify for the program, need to reside within 62 miles of the Texas-Mexico border. And The program serves these individuals through home and community-based services involving substance use prevention and intervention. And one thing about this program is it mainly serves individuals in regions 8, 10, and 11, and I can show you those on the map. And then, of course, at the end of the presentation, we're going to have a link to where you can review all of these services. All right, so the next service on the continuum is treatment. So substance use treatment is designed to treat clients diagnosed with a substance use disorder in a state licensed clinical setting. Treatment services here in Texas, and the ones that I'm referring to right now, are based on the American Society of Addiction Medicine levels of care. So right here, you can see that we have listed out the various levels of ASAM. There's outpatient services, intensive outpatient, ambulatory withdrawal, which is ambulatory detoxification. Then there's low intensity residential services, clinically managed medium intensity residential services, and then medically monitored withdrawal, which is residential detoxification, as well as opioid treatment programs. So your MAT services or NAS services. So outpatient treatment offers substance use treatment in a licensed community-based setting where individuals can receive services while still attending work, attending school, and being able to engage in those parts of their lives, but also then getting that support while maintaining in the community. Residential treatment is going to be a more intensive level of care, and that's going to be for individuals who need to maybe be removed from their setting in order to begin to stop using substances or start their recovery journey. Those services occur in a state licensed residential setting, and they can offer things like counseling, case management, education, and life skills training. So we here in Texas, we have 2 detoxification services that we offer through HHSC, and that's going to be residential detox, where again, somebody is in a residential licensed setting where they receive they're medically monitored while they detox. And then we have ambulatory, and that's going to be where an individual, they still reside at home, and then they go to the detoxification facility daily and engage in services at the facility, but then they go home in the evening. So that's going to be maybe a lower intensity of detoxification. Okay. We have medication-assisted treatment, or MAT treatment, which combines prescribing medication with counseling to treat opioid use disorders. And then we also have an adjunct service here called co-occurring psychiatric substance use disorder. And the adjunct service is for those who have a substance use diagnosis as well as a psychiatric diagnosis, and that involves case management and counseling. And I think Christina is going to just give us a little more information on some of these services.
Thanks, Edith. So when it comes to the MAT services, we did want to make a point to inform everyone that adult Texas residents with moderate to severe opioid use disorder for at least 12 consecutive months are potentially eligible for MAT services. And there are some stipulations when it comes to a youth who would like to receive MAT. So if it's someone under the age of 18, there must be a signed consent form from their legal guardian or parent. The youth must also have 2 failed attempts at detox or some type of short-term residential setting. So that's kind of the stipulation. If a youth is wanting to receive MAT services, there must be those 2 prior documented attempts for that. Now, the one exception to that is if it is a pregnant youth, she would not have to have those 2 prior documented attempts. If she wants to engage in MAT services, she can do so if that's the course of treatment she would prefer. Next slide. Priority population designations. So this is a list of guidelines that basically helps providers to put individuals on the wait list if they're unable to admit a person to their facility immediately, if they're at capacity. These are the priority populations for admission. So some of these are based on federal guidelines, and then some of these are based on state. So as you can see, there's pregnant injecting individuals, pregnant individuals. So that would be the difference of someone who's injecting a substance versus just pregnant individuals. The pregnant individual might be taking things orally in that, as far as that differentiation. And then injecting individuals underneath that, that means it's open up to men or women who are not pregnant that are injecting a substance. And then the state priority populations, people at high risk of overdose based on their use and what they're using. And then as well as individuals referred by DFPS. So the federal priority populations is designated by SAMHSA. And the one thing I also want to note is the 2 pregnant priority designations, those individuals are admitted immediately. So if you have a pregnant individual who is wanting to receive substance use treatment, she should be admitted immediately, or at least very quickly, as soon as the next bed is available. She would jump to the top of the wait list in that instance. And these help our providers to designate what order, because if, for example, if you have somebody who maybe is referred by DFPS and they call in, they're screened, but they're put on the wait list. But if the next day a pregnant injecting woman calls, that pregnant injecting woman is going to be admitted before that DFPS referral, just because the pregnant woman is higher up on the priority designation. Next slide. Treatment services for females. So these are the programs, both the funds and the programs that I oversee with the Texas Health and Human Services Commission. So the Substance Abuse and Mental Health Services Association, or SAMHSA as we all know it, provides block grant funding to the states, and it requires that we provide a set aside amount specifically for the treatment of pregnant women and women with dependent children. The Texas Health and Human Services Commission, we set aside at least 5% of our funds for these specific services. So if a woman is admitted to a treatment program who receives these special funds, she will at that point will receive gender-specific groups and counseling, parenting and reproductive education, trauma-informed care, as well as life skills counseling and education. So eligibility for these funds and these treatment services, she must be a Texas resident, she must be pregnant or have a dependent minor that she's responsible for the care. Now, I like to be very specific about eligibility when it comes to a woman responsible for the care of dependent children, because most people think in this scenario that, oh, it's the mother and her children. And as many of us know, families can be quite complicated sometimes. So if it is a stepmom, maybe it's a blended family, and the birth father has custody and he's remarried, and this is the stepmom, and she's responsible for the care of minor children, she could absolutely be accepted underneath these funds and into one of these treatment programs. Another common scenario I see is maybe if a grandmother, so if a grandmother is caring for her grandchildren because the mother's out of the picture for whatever reason, the grandmother can absolutely come into services underneath these funds. So it's just to help people be mindful of that there is a little bit of flexibility when it comes to eligibility of both these funds and the services offered. So for these specialized female funds, for the treatment services, we offer outpatient, residential inpatient, detoxification, both for residential and ambulatory, as Edith previously discussed, for our specialized female funds. So we did want to make a point to also inform you, we do have another set of funds that we call neonatal abstinence syndrome funds, or NAS, obviously, for a special program that is in San Antonio, as well as special programs through certain MAP providers. So now the NAS funds are not from SAMHSA, they are actually state funds, but we felt it was important to include these services within this presentation in this section, just so again, you know what services and different funds are available to help these women gain access to services. Next slide. Women and children residential treatment facilities. So this is a really amazing program that allows the opportunity, and basically this is women and children residential treatment facilities that were created using evidence-based principle that women who receive treatment while having their children with them increases outcomes. So the idea and concept behind this is the woman not only goes to treatment, but she can bring her children with her while she's receiving the treatment. As we previously discussed, childcare is one of the barriers to treatment. This eliminates that barrier, and it keeps the mother with her children, which is a top priority for all these women. So this is a family-centered treatment that produces 3 best practices and positive benefits. So these positive benefits include individual outcomes such as changes in substance use, employment, criminal behavior, and health status, right? Because these are the things that impact her on an individual basis. That helps improve those outcomes. And then we have the relational outcomes. So these might look like the parent-child relationship, family stability, attachment, relationship satisfaction, reunification, which is the ultimate goal. We want these mothers to stay with their children. And then reduce violence and parenting improvement. And then we also have system or societal outcomes with this model. This includes employment rates or tax revenues generated by employment, reduce criminal recidivism and cost savings accrued to the criminal justice system, as well as improve prenatal and birth outcomes and reductions in hospitalization costs for infants and reduced use of other service systems. So these are all different outcomes based on this treatment model. This was reviewed by the Center for Substance Abuse Treatment within SAMHSA, and how they studied family-centered treatment for women with substance use disorders. Next slide. There we go. This slide is the 10 facilities we have within Texas. These are the women with children treatment facilities where the woman can bring her children with her. As we stated, there are 10 across Texas. We have, out of our 11 regions, we cover all regions except region 2 and 11 at this time. It is also important to note, we unfortunately do not have a women with children residential treatment facility in 2 and 11. It is also important to note that in region 8, we actually have 2 facilities there in San Antonio. The Center for Healthcare Services facility, that is a treatment program that is funded by NAS funds. And so as we were previously discussing, that's a different set of funds used to provide treatment services, and that's how we have the second facility in San Antonio. Also with that facility, the mother must have an opioid use disorder diagnosis in order to be admitted into that program. Now, with that being said, eligibility for these, again, it must be a female who resides in Texas. She must be diagnosed with a moderate to severe use disorder. So the only stipulation with these particular facilities when it comes to pregnancy is she must be in the 3rd trimester in order to potentially be eligible for one of these particular facilities. So another really neat thing about this program is if she does have CPS involvement, if CPS has removed the children, she can reside at one of these facilities for up to 30 days without her child being with her. So that way, if CPS stipulates she must have some clean time before she can be reunified, she can be at one of these facilities for up to 30 days with the goal of reunification. So that way, once the child is reunited with her, then she can continue her treatment while at the facility. So it's also important to note with this, while this only shows 10 facilities, this does not encompass all the treatment providers that receive those specialized female funds. We have over 30 treatment providers across the state of Texas that provide treatment services to the women that are eligible for these funds. So it's just, we wanted to make a point to specifically highlight these women with children facilities. But as far as the other treatment providers, that basically they provide treatment to women, they just can't bring their child with them to treatment. And so those other providers, we cover every single region, both for residential and outpatient services. Next slide.
Okay. So recovery support services are the next service on the service continuum. So we've already gone over substance misuse or use and misuse prevention. We've gone through substance use intervention programs, and we just finished with substance use treatment programs. And so the next and last on the service continuum is recovery support services. And these services, their main goal is to increase long-term recovery and increase recovery quality. Services are provided by peers who are guided by the peer principle. And the peer principle is what it is it's an enhanced sense of self-efficacy, which comes from mutuality, social affinity, and common lived experience. Peer support is offered through recovery support service organizations. What it is it's when someone with lived experience gives encouragement and assistance to help someone who has a mental health diagnosis or a substance use disorder achieve long-term recovery. Peers offer emotional support, informational support, and a connection to the recovery community. Peers can also assist individuals with resources for things like housing, transportation, employment services, and health services. Also, recovery support services can be provided at all stages of recovery. And whether it's pre-recovery, the initiation of recovery, stabilization, before, during, or after treatment, these services are available kind of during that whole process. So next we have substance use resources. And you can see we've kind of shown you which ones are going to be national resources and then which ones are going to be local to Texas. So we have SAMHSA, which Christina mentioned earlier. We have OSAR, and that's going to be a state resource. And then we have our state substance use services. And I'm going to go over each of these. And I want everyone to keep in mind that this is not a full list of substance use resources. It's just a few options to help you get started. But I definitely encourage you to kind of get out in your community and see what kind of resources there are in your area. All right, so SAMHSA. And SAMHSA is the agency within the U.S. Department of Health and Human Services that leads public health efforts to advance the behavioral health of the nation. SAMHSA's goal or mission is to reduce the impact of substance abuse and mental illness on America's communities. We have a link to their website as well as a phone number. I highly recommend you go check them out. They have a lot of great resources, a lot of great information. All right, OSAR. So like I mentioned earlier, OSAR stands for Outreach, Screening, Assessment, and Referral, and is a substance use intervention program. And sometimes you'll hear that it is considered the front door for individuals who are trying to access substance use in the state of Texas. The purpose of OSAR is, like I mentioned earlier, to connect individuals to substance use services in their area or even across the state. OSAR services offer screenings, so they can screen someone for a substance use disorder. They can do assessments. They can provide referrals to treatment facilities as well as referrals to other things like community mental health services, recovery support services, prevention services, other intervention services, maybe medical services. So they kind of have a pulse on all of the resources available in their community for individuals. They can also provide substance use education. So OSAR screenings and assessments are based upon a client's self-report or an individual's self-report. And they also go by the DSM-5 as far as making a diagnosis for a substance use disorder. And this diagnosis is mainly going to be only focused on the last 12 months, as that is the guideline set in the DSM. OSAR services are free, and they are available to anybody who resides in the state of Texas. That being said, the only requirement is that you are living in the state of Texas. And so, you know, I always like to let people know that whether, you know, you are, you know, maybe have few resources, or maybe you even have insurance, but you're still like, I'm not sure where to go or how to access treatment services through my insurance, OSAR can help you with that. Additionally, if you don't have insurance or you have low to no income, OSAR can assist in connecting individuals with state funding for the treatment services that are offered through HHSC. So that is one of the great benefits about OSAR, is it can help individuals who may not be able otherwise to access these services get into the treatment that they need. Each OSAR is going to be attached to a local mental health authority or a local behavioral health authority, depending on where in the state the OSAR is located. What's great is we have 14 OSARs across the entire state of Texas, and you can see on the map, this is how kind of it's all broken down. If you go to the website, you can click on the different regions, and it'll show you by county what counties are covered under which region, so you can figure out where your OSAR is. We have 3 OSARs actually in Region 3, which is going to be the Dallas area. And then we have 2 in Region 6, which is going to be the Houston Gulf Coast area. The rest of these are all, each one of these is covered by an individual OSAR. All right. The last resource here is it's a local resource. So just like OSAR, HHSC substance use services are going to be specific to the state of Texas. And what's great is we offer a variety of substance use services, and we've kind of gone over them as we've gone over this continuum of care. But again, that's going to be your prevention programs, your intervention, your treatment, and your recovery support services. And if you're interested in any of those services or kind of what's available to you in your area, I highly recommend going to the Substance Use Services homepage. and there you'll find all of that information. The other really great tool we have is a services locator map. So you can look at the map, find wherever it is that you're needing resources and click on it, and it'll show you what is available through, HHSC services in that area, whether it's treatment, whether it's intervention, like where's my OSAR, anything like that, or even, if it's MAP services, you can find those because they're located on this map. So again, that's another really great resource. All right, so that is it. I guess we will go ahead and take questions if there are any.
Okay, let me pull up the chat. We do have some questions here. The first one is, who is the extended population that HIV outreach and early intervention will be reaching with restructuring?
So because we are phasing out those two populations, we are in the process of expanding to a wider population. And as soon as that program is ready to go, you'll be able to check our website and learn all about what it is that we are offering.
Okay, thank you. Next question that came up is the RBI program available to undocumented individuals as well as others?
So what I'll say is the requirements for the RBI, or the Rural Border Intervention Program, is that you are an individual residing in either regions 8, 10, or 11 in Texas, and that you're 62 miles within the Texas-Mexico border. One thing I will say is, I know, like for OSAR, for example, the only requirement is that you are residing in the state of Texas. So if you, maybe don't have a permanent address, but you are here in Texas, then you qualify for OSAR services.
And I'll add to that, I think with the term people here residency, and when we use the term residency, we're talking about where do you live. So, and that phrase sometimes gets confused with about citizenship.
Okay, thank you. Okay, we have another question. It says, do each of the 14 OSAR providers provide the full continuum of care from supportive outpatient to aftercare continuing care?
Yeah, so the OSAR services, kind of like I mentioned, they're going to be an intervention program. So their main goal is going to be to screen clients and connect them with those other continuum of services, connect them with those other continuum of services. So, they'll screen a client and then they'll refer them to either treatment or in another intervention program or recovery support services. So while they don't offer treatment themselves, what they do is they connect individuals to treatment and kind of serve as that guide for somebody who is interested in substance use services, but may not know where to start or maybe what they need, but they know they need something. So going to the OSAR is a great way to kind of start.
Okay, we have one more question. How many state-funded detox beds are available?
So whenever I have questions about like what's availability, I will say availability as far as wait lists and things like that can vary day to day even. So if there is a specific service an individual is looking for in a specific region, I highly encourage them to use the services locator map, because they can pinpoint what region they're in, and they can, if they know that they need a certain service, they can just look it up and call that provider. And then if an individual is, wondering, hey, does that provider have availability or offer the service? Again, that services locator map is going to be able to help. And then you can always call the provider too and just kind of ask them, I'm interested in services. Do you have a wait list? That kind of thing.
And I'll add to what Edith said, reaching out to see what availability looks like, and that does absolutely vary on a day-to-day basis depending on what's going on. Detox in particular, as we all know, Texas is very large, and so there are some areas where that is a gap as far as detox goes in particular. But if the individual's in a area or region where there's not a detox center close to them, that's where the OSAR can assist them with not only the referral, but if the client needs assistance with transportation to get there, the OSAR can assist with that as well.
Wonderful. Thank you so much. Well, that was the last question for the presentation. I wanted to say thank you so much, Edith and Christina, for taking the time and for participating in Texas NAS Awareness Month. We truly appreciate it. And we've posted your PowerPoint online. And so all the links that you've been talking about, all people have to do is open the PowerPoint and click on them so they have the resources. So I just want to say thank you to everybody who joined today, and stay safe out there. We truly appreciate you.
Thank you.
Thank you.